Well, this week we are marking Black Maternal Health Week, and it's a time to raise awareness to the fact that Black women are dying from pregnancy-related causes at a higher rate. The latest numbers from the CDC show the maternal mortality rate for Black women in the U.S. is about 3 times higher than women of other races. And one possible solution to improving birth outcomes for both mom and baby is increased access to doula care. And March of Dimes and doula care provider Chicago BirthWorks Collective have teamed up to bring free doula services to mothers on Chicago's South Side. And patients supported by the program at Advocate Trinity Hospital get doula care throughout their pregnancy. That includes prenatal visits, birth and postpartum prep, and education, in-person labor and birth support, and 2 postpartum visits as well. Joining us now are 2 of the project leaders, Michelle Edeni, March of Dimes Director of Maternal and Child Health. Good morning, Michelle. And also we have Tayo, and say your last name for me.
Mbondi.
Mbondi, and you are the co-owner of Chicago BirthWorks Collective.
Yeah.
Ladies, thank you so much for joining us to talk about this.
Absolutely.
Thank you for having us.
Let's first share the role of the doula and the type of support that they provide during pregnancy.
I can talk about that. So we are, as I like to say, the non-clinical support person who does all the catch-all. So all the things that you can't fit into your typical 15-minute really rushed prenatal visit, your doula's answering those strange questions that you otherwise would be answering on the internet, on Google.
Yes.
And then we're also providing a lot of hands-on support. So my back hurts in a way that my provider's not able to really adjust. We're providing lots of context and information, education, and we're with you throughout your entire birthing time.
Wow, that's such a support. I know even just going to any type of doctor's visit, it could be 15 minutes, it's overwhelming to just, get the information and absorb it. How have we seen this type of help improve the health of the baby and the mother?
Yes, this type of support has improved the health of the baby of the mother by providing culturally competent care and trust. The mothers are more comfortable speaking with their doulas and getting their questions answered, and just reviewing some of their concerns and being able to take that back to their provider with more confidence and being able to advocate for themselves more as well.
And I know this program is about providing free doula services to patients who particularly are in areas where the cost of those services could be a huge barrier to getting that type of help. Why is this a priority to help this program?
Well, this is a priority because we know that access to care is a very large barrier that a lot of Black women have, and we wanted to remove that hurdle and provide them with the care that they need. Also, it's important because the postpartum support has been expanded in the state of Illinois through Medicaid reimbursement up to 1 year. So by providing the patients with the doula support and making sure that they have access to it, it really is just opening up more people to understand that doula support is here in Chicago. There are culturally competent and community-based doulas here in Chicago, and these services are available through your benefits.
And I understand that this project is in the next phase now after piloting, and that was in 2024. What impacts are you seeing as a result of this program?
I can talk about that. So we've been doing this work for much longer than the last few years. So having the opportunity to get this in front of the providers who can give this opportunity directly to their patients is a huge deal. And now patients are so comfortable coming to the hospital knowing I'm not gonna have to search to piecemeal my care together. So we're seeing a larger interest in pursuing really good prenatal care. Folks are always kind of like on the fence. They're like, okay, I'm 15 weeks and I'll go to the doctor when I feel like it. Now people are like, I'm gonna go at 8 weeks. I know for sure that my provider's got a really good team of community-based doulas, social workers, care managers that are going to make sure that my care is as high quality as it can be.
So what's next then? Are you looking to expand this?
More doulas everywhere.
Yes, we've received a lot of interest from community hospitals in Chicagoland and in Illinois. And so the next step is to expand this so that we provide more doula services within the clinical setting, and also providing the training to the healthcare providers so that they have a better understanding of what doula support is and they can work collaboratively.
It's amazing to have community-based programs and people stepping in these gaps. Thank you both for joining us to talk about this. We really appreciate you. Thank you. And we do want to note that ahead on our 9 a.m. show, we're going to continue this conversation. A mother and doula pairing will join us, so we'll talk more about the impact of the program and how it all works, just to expound on what you ladies mentioned. Thank you.
Thank you.